Is your shoulder separated or dislocated? Did you know there's a difference? If you've had a shoulder injury and you are looking for more information regarding ligament damage, then you're in the right place. And stay tuned to the end of the video for ways to decrease your costs when it comes to imaging studies. Hi, I'm Dr. Jennifer Tucker, your host of the Surgeon's Guide to Rider Recovery. Shoulder injuries can be very confusing because of all the structures that surround and attach to your shoulder. Did you know that the shoulder is one of the most mobile joints in your body? Take a look at this x-ray. Do you see how this axillary view shows how big the ball is in relation to the cup? It's like a golf ball on a golf tee. And you can imagine it wouldn't take much to tip this ball right out of place. What keeps this ball in place is the many soft tissue structures working in concert to keep this ball right up against the socket. These structures include your rotator cuff, biceps tendon, your labrum, and muscles that surround your shoulder, like the deltoid and serratus. The actual shoulder joint is called the glenohumeral joint, and this joint can dislocate. The most common direction is anterior, which looks like this. This injury is caused by suffering an anterior blow or landing on your abducted, externally rotated and extended arm. This force causes the ball to stretch and tear the soft tissue structures in the front of your shoulder, such that the ball ends up in the front of the socket. There are posterior and inferior dislocations as well, but these are less than 3% of dislocations. If you would like more complete information about all shoulder dislocations, then check out my shoulder dislocation video under the Ortho Info section. The degree to which your soft tissue and bone was damaged will determine your treatment. Oftentimes, advanced imaging will be necessary to assess the soft tissue structure surrounding your shoulder. Your age, level of competition, where you are in your season, and whether this is your first injury are all considered when determining your treatment plan. There's currently no consensus on the best treatment for first-time dislocators. I will rely on the severity of your soft tissue injury, the amount of bone involvement, to guide what treatment would be best for you. If this is your first time suffering a dislocation, your reduction went smoothly, and you don't have any nerve symptoms or bone injuries and minimal soft tissue tears, the goal is to get you back in your saddle in 2 to 3 weeks. Using a sling has become controversial as its benefit of maintaining a reduction has been called into question. In my experience, I've seen more patients re-dislocate from not wearing their sling, and I have not had any patients re-dislocate while wearing their sling. So I'll keep my patients in a sling, but working on elbow and hand motion for a few weeks. Then we'll reassess and see if it's time for you to get back on your horse. It does take time for your soft tissues to heal, and recurrent dislocations are a risk, particularly for males under 20 years of age with hyperlaxity and bone involvement from their injury. Now that you have more information about shoulder dislocations, what about shoulder separations? What's the difference? The difference is the joint. A separation occurs at a completely different joint than the shoulder. A shoulder separation occurs at your acromioclavicular joint, also known as the AC joint. The AC joint is made up of your clavicle and a projection of your scapula called the acromion. This joint can separate when you fall or are hit with your arm in adduction, or bringing your arm close to your body. Depending on the force, you can injure your AC ligaments here or your coracoacromial ligaments here. And separations are graded based on where your clavicle sits in relation to your acromion, which does directly correlate with which soft tissue structures were injured. The more soft tissue structures are injured, the more likely you are to need surgery. We use the Rockwood classification system to determine who needs surgical stabilization. Grade 1 through 3 separations can heal without surgery, but it takes time. Depending on your type of riding, it may be a few months before you're back in the saddle, and over 3 months before you're able to compete. So would it be better to just have it fixed? Not unless your injury is grade 3 or higher. And even then, there are risks. This isn't an area where I would push limits because failure rates and reoperation rates are high. Remember at the beginning of the video when I mentioned a way to decrease costs of imaging? As a shoulder specialist, I may need to order an MRI to assess the soft tissue structures involved in your dislocation. Now, we have an MRI in our office and can provide cost savings to our patients, but not every practice has that option. So if you need an MRI, check out clearhealthcosts.com and search for the cost of imaging studies in your area. This may require phone calls to your insurance carrier and radiology centers, but could end up saving you hundreds of dollars. Now, if you like what you've seen thus far, please like, comment, share, and subscribe for more rider recovery content. If there's a topic you'd like for me to cover, please comment or shoot me a message. Your recovery is very important to me. Thanks for watching.